So we take this away, okay? And I don't know if this will increase her internal rotation motion or not, okay? But we'll test it and just relax, okay? And that's clearly more. So it did increase her internal rotation, even though it had a soft end feel. So that really challenges some traditional beliefs, such as when you have a normal end feel, there's no issue, okay? And she had normal end feel here at 30 degrees. So I didn't think it was going to change, but look at that. You know, that's looking like 45. Wow. So lie on your stomach. So some of these traditional beliefs need to be challenged. And maybe in certain contexts they're relevant, but in others they might not be, okay? I didn't point out that this trochanter felt a little more posterior. And I can take up the slack now. And then I can spring it. You can see the force go through the hip down into the lower extremity. Okay, so we have that spring mobility. Let's keep filming. What I would like you to do is walk down the hall and back, and then come sit in the chair in the hallway and tell us your thoughts. I like to ask open-ended questions, you know, let the patient, you know, not be, I don't want to bias their answer.
I feel lighter.
You feel lighter. Okay, okay. And I think this is the natural way that your hip is supposed to be. So I feel like we brought you kind of back in line with what I like to call your posture and movement template. Okay? Nice. So, and it may affect other areas in your body. I had one patient, she said, I hurt my foot, and then over time the pain just went up, and she did exactly that maneuver with her hand, and developed TMJ pain. And she said, I told all my doctors over the last 15 years that it started in the foot and then it just worked its way up. And they all said, that doesn't make sense. Interesting. And she had a very compressed TMJ, symptomatic jaw, okay? When I unlocked the cuboid, when I restored movement in her foot and in the rear foot, called the talocrural or talocalcaneal joint, when I restored normal movement in that joint, she felt a sense of whole body release. And I went back up to treat her jaw and it was fine.
Wow.
You know, so me banging away at trying to treat her jaw, wasted effort.
So it really was the foot.
It was the foot. And her nervous system said, this is how we're going to deal with that. You know, and maybe the next 10 people that get restriction in their foot, maybe they'll respond differently. But we treat individuals, okay? We treat the person and we let the person's body tell us what it's doing. We don't tell the body what to do.
Exactly.
Just like your fibula, it was stuck superiorly. And I've seen 3 of those in 10 years. But it took me about 2 minutes to find it.
Yeah, it took you fast. I mean, you were done it in like 2 minutes.
And how is that part of your body behaving now?
I feel like when I walk, I'm more sturdy.
Nice, nice, nice. And it's funny because us guys that still treat joints get a lot of flack, you know, especially on social media. You know, just exercise, movement is lotion, you know, just exercise it. And I'm like, but just exercise is what you've been doing for a very long time.
18 months.
Yeah, yeah, and it didn't bring that fibula back
Stretching,
down. Yeah.
Strength training, everything.
And now we can whine and say there's no research that the fibula gets stuck upward. Okay, that's fine. There's no imaging that'll show that, you know, and that's fine too. It is a specific, very specific, skilled, hands-on testing. It is what it is. That is the limit. That is what manual therapy is. This isn't a research clinic where we have, you know, 3D CAT scan and digital motion X-ray, et cetera, you know.
And if you had that, could you really see it?
It'd be, I don't know.
Yeah.
I mean, I really don't know if you would. There's one standard of research that they insert titanium balls and then measure movement. They do that in the Scandinavian countries. I don't think in the US, I don't think that would pass the research board, you know. But that's kind of the standard of the benchmark of evaluating joint motion. And of course, I have to dig deep in the literature and say, but can the balls move at all? Do we know that they're solid in there, et cetera, et cetera? But that would be the way to test that. It's not going to happen, not in this country. But I think that your body's going to be happier, and there's less noise in going up your spinal cord from that joint, because that hip joint is now functioning better, as is your fibula. And so, you know, the messages that go up to your brain are quieter.
Gonna calm down.
Yeah, yeah. So the other nice thing is this is a one-time treatment.
Awesome. I'll have to keep going somewhere.
Yeah, I mean, that's it. I do it once. Nothing's going to make your fibula go back up unless you jump curbs like you said.
Yeah.
Yeah. Unless you go to jumping curbs again, yeah, it'll come back, sure.
That's what.
Sure. But I'm going to teach your husband how to correct it if that should happen, because you live in New Jersey.
Yeah.
And I live in Aurora, Colorado, by Denver. And I will teach you, well, I already taught you how to put that foam there.
Mm-hmm.
I think it would be worth treating it for about 3 weeks. So maybe every Saturday, lay on the floor, put the foam there for 3 minutes.
That's it?
That's it. And yeah, because the way it works is that now when you walk, now your pelvis is going to find that extra rotation. Okay?
It won't be stuck.
Yeah, so you're going to have freer right rotation of the pelvis. It's going to find that extra little bit of movement that we gave you right now. Take a walk one more time. Keep filming.
Okay.
And tell me what you think your pelvis is doing.
It just feels calm. It just feels. It feels light. I don't know how.
The pelvis feels light.
Yeah.
Okay, all right. Well, you know, what I'm suggesting is that now when you walk, you have a little extra right rotation of the pelvis, which is, you know, basically if the top of your hip goes into internal rotation, relatively the pelvis is externally rotated, right? So that's a fair statement that when you walk now, your pelvis rotates more to the right, finding that new range of motion. It's self-reinforcing.
Awesome.
So just walking, now motion is loosened.
I know, we walked yesterday and it felt good.
Yeah, very good. Well, I love this work. I love doing a one-time correction. I don't call it an adjustment. I don't call it an alignment that needs to be repeated. I call it a correction. Fix it, be done with it. But the secret is it takes a little bit of time. It takes a fulcrum. It takes a specific direction. And the amount of force needs to be very mild so your nervous system says, this is weird. Jerry put a piece of foam under my trochanter. Am I going to let him do this or not? That's okay. It feels all right. Kind of novel, kind of interesting, but I think I'll let him do that. So the nervous system cooperates and you get that, if I can use the word, release.
Yeah, that's what it is.
Yeah, good. Well, thank you.